Hi, my name is Greg Fell, I'm Director of Public Health. This is the Situation Report and Epidemiology of the 2nd of August. So case rates first, about 450 to 400,000 and falling, with some significant caveat on that number. The most important caveat is that COVID testing has dropped. The number of people getting a test has dropped significantly. The positivity rate has held up, so that's a really good indicator that the 7-day case rates are becoming less and less reliable as an indicator of what's actually going on. Best thing to look at is the ONS infection survey and or the REACT study. MB, the ONS survey is a week behind, but basically says that population prevalence is about 1.7%. It was up from 1.5% last time there was a data check, about 1 in 60 people, and still going up. So whilst the 7-day case rates are falling, the actual incidence is continuing to go up. So I don't believe that the case rate fall is actually real. So we've not yet seen the full impact of step 4, aka Freedom Day, very badly named, but there it was. I think there'll still be more to see from that. The rise started in young people and young adults, but now spreads to most of the population. Perhaps with the exception, the lowest rise is in the oldest population, which is very reassuring. They're the most well-vaccinated population. Still, significant number of people who are unvaccinated, and if not yet fully vaccinated, there's a much greater chance Delta will find you. So if you've not yet had the second dose, please get it soon. If you've not yet had the first dose, please get that really soon. Hospitalizations are increasing. The number of people admitted because of COVID continues to increase. The number of people who are needing respiratory support continues to increase. Deaths have started to rise again. A very low number, but that will probably continue in the wrong direction. Remember, it's a respiratory virus that harms people. That hasn't changed. Delta remains the dominant virus, and that will continue for the future. So how it plays out comes with a whole dose of uncertainty, as ever. There was a hugely helpful paper that was published in the SAGE set of papers last Friday from SPI-M, the modelling group, their statement of concerns over the next few months. I can find nothing in there to disagree with. So the key concerns going forward: high incidence and high prevalence. We're seeing that at the moment. That's creating pressure within the NHS, not just within a hospital bit of the NHS, but also within primary care and social care, exceptionally busy. And obviously, people don't use the NHS unless they're poorly. So most importantly, high incidence and high prevalence is leading to poorly people. And we don't want that. I don't want that. No one else wants that. You get to a stage where critical infrastructure starts to become unable to operate because so many people are poorly all at once. And it's also a challenge for closed settings, particularly care homes, is a worry for the future. Vaccine effectiveness and coverage. So the vaccine works undoubtedly. It reduces the risk of transmission by about 75%. It reduces the risk of hospitalisation and death by about 85%. Those numbers are startling. Those numbers are more positive than I dared hope for. It's not 100% effective, and not 100% of the population have the vaccine. So despite a really effective vaccine, there are still some concerns there's still some concerns about hospitalisation, even in those who are vaccinated, though those who are being hospitalised now are largely unvaccinated. Population immunity and waning immunity will be a concern going forward into the future. A whole heap of uncertainty in that space, but it's likely that we'll be in the space of booster doses over the autumn and into the winter. Autumn into winter, schools restart, university restarts. We'll see the impact of seasonal viruses, which are normal for that time of year, and we'll all be indoors a lot more. Novel variants. The three concerns: transmission advantage, is it more transmissible than Delta? Immune escape, will the vaccine work? And more severe impact. So currently we're not seeing much risk from novel variants, but we can't rule that out. So we need to remain vigilant for some time to come. And lastly, it's difficult to say what will happen in the international context around COVID. So there are some concerns, and we're still not out of the woods, I'm sorry to have to say. So on vaccination uptake, vaccine uptake in Sheffield is better than many major cities. Clearly that's good. As of last week, more than 77% of over 18s have had their first jab, and just over 61% have had their second jab. Clearly that's good news. Flip it, the bad news is that a significant proportion of over 18s haven't had their first dose, and about 40% of the adult population hasn't yet had their second jab. It's the second jab that really matters, that gives us most protection. You're only partially protected after dose 1. Whilst vaccine passports probably won't be required to return to university, the number of students coming back to Sheffield, you are very welcome in Sheffield by the way, it's significant, and I would ask all students who are studying at a Sheffield university to get their vaccine as soon as possible, regardless of where you happen to be over the summer break. Even if you're young and healthy, without being vaccinated, COVID can still be a serious issue. It can still cause you to be acutely poorly, but also can cause long COVID. There was some ONS data published just over the weekend that said about 14% of people who have COVID develop symptoms that go on for longer than 12 weeks, and about 1 to 5% of people who have COVID develop symptoms so severe that the impact on their daily life. 1 to 5% of a big number is a big number, and it's something that we're trying to avoid. So all up, that's about 10,000 people in Sheffield that we think have long COVID. Today, it's been reported that booster vaccinations against COVID will be offered to as many as 32 million people from next month, alongside flu vaccination. They'll be offered to the most vulnerable people first, so we'll start with those over 50 and then immunosuppressed patients of all ages. And the JCVI's position on that is pretty clear, and will focus the boosters on those who've got most to benefit and those who are least likely to have a good immune response. There are lots and lots of options to get vaccinated in Sheffield. The Octagon is no longer available for walk-ins, but we have a new vaccination centre at Longley Lane, and you can drop in without an appointment. Lastly, on vaccination in pregnancy, a lot of traffic that comes into my inbox and my timeline that lots of people who are pregnant are concerned about the COVID vaccination in pregnancy. It's safe, it's effective, it's recommended by the Royal College of Obstetricians and Gynecologists, Royal College of Midwives and the NHS more broadly. There was a letter that was sent out by a number of NHS clinical leaders just before the weekend that was underscoring the importance of getting the vaccine if you are pregnant. The Royal College said that pregnant women are more likely to be at risk of becoming severely unwell if they catch COVID, and are more likely to have pregnancy complications such as preterm birth or stillbirth, which is something that nobody wants. So the vaccination is safe, it's effective, it's recommended, and I would recommend that if you are pregnant but haven't yet had the vaccination, then do so as soon as possible.